What is PCOS? PCOS stands for Polycystic Ovarian Syndrome. So, before we attempt to discuss any of the conditions, like why we have chosen this particular topic as our first series, is because when you look at the data, uh, what we see is, even though this is an exclusive condition that we see in females, it is quite surprising to see that women who suffer from these illnesses, or be maybe a caretaker, or maybe somebody who's known to suffer from these diseases, are not aware of this condition at all. Like that's quite depressing. Like, provided the level of technology that we are living in, the level of the technological age that we are living in, all information we have at hand. Even imagine today, like the technological age that we are living in, it's quite surprising how these informations are still not reaching to the people who actually need to know about these conditions. So, with this data in background, we will proceed to today's discussion. Next slide, please. Yeah. This is just another data that shows the same thing, because many of the PCOS people, or many of the patients who suffer from these conditions, may be married. Some of them are still single. So it somehow we assume that this is a problem of the female, and we as husband or other male members of the family have no part in any of these aspects of the disease. That is completely wrong, because we are responsible husband or responsible citizen. We have equal share, or maybe more than that, in knowing and managing this condition, because many of the treatment aspects, like, there needs to be help as well as understanding from your partner or from your caretaker, which may be a male member of the family. So the data shows females, majority of the female are not fully aware of what PCOS are and what are its implications. And male members, over like they are more of the male members are completely not aware of what are the implications of the disease, how it is going to affect their partner, and what is the natural history of the disease, like how is the disease going to behave when it is left to evolve over time. Next slide. Yeah. So with that background information, so at this point, we know that this condition is not known completely to too many other people, with whom they should know. So we start from the very basic. What is PCOS? PCOS stands for Polycystic Ovarian Syndrome, which means, cyst means it's kind of a bubble. Poly means multiple. So if you take a woman's ovary, you can see multiple bubbles in their ovaries who suffer from PCOS. So many of you, if you start reading from the internet, might come across another term which is called PCOD, which stands for Polycystic Ovarian Disease. So these two are different. It is not the same. Polycystic Ovarian Disease means you take the ovary, if you do an ultrasound, you might see some bubbles, and that's it. They may not have other features of this syndrome. PCOS, which means it contains syndrome. Syndrome means there are multiple complaints or multiple symptoms or features for this disease, along with the fact that their ovary contains multiple bubbles or cysts. Those symptoms can be increased facial hair, like mustache and beard. Then you can have weight gain, or if you try to lose weight, you find it difficult to lose weight. You may have difficulty in conceiving a baby, which means that you may have reduced fertility. Over time, your weight gain may cause developmental diabetes. And if you keep on going untreated, you might even have a significant high risk for uterine cancer. So that is the entire spectrum of PCOS. So don't be under the impression that, like, if you have PCOS, you will get all these conditions. No. If you do not treat this condition, and if you left untreated, like, we are not taking any treatment, I know I have PCOS, but I'm not going to do anything about it. Then over time, all these conditions can come up. So you have to know that these are there. And you also have to know that there are ways if you treat very well, you can change from all these complications. So by definition, PCOS is a condition which affect your periods. Like women who suffer from PCOS may have reduced number of bleeding, like reduced number of cycles, or they may not get cycles at all. It might affect your fertility, that is the chances of you having a baby. And this is due to a imbalance in the hormones. Like everyone, like me, you, everybody has got some amount of male hormone, some amount of female hormone. In males, the male hormones are higher, female hormones are lower, and the opposite that happens in females. So there will be an imbalance in that hormonal balance, and it also affects your external appearance, which means you have weight gain, excess hair, and difficult to lose weight. Now we know that this is the condition. What are the symptoms? Like what all things you should notice and when to go to medical help. So the symptoms that we commonly encounter are irregular or missed menstrual cycle. That is very common. But be under the impression that women may not be having an exactly strict cycle of 28 days. It can go 30, 32, but still they bleed. If it goes like more than 3 months, I don't have any cycles, and I'm married, I'm not married, I'm single, I have no chance of getting pregnant, then that is considered to be a reduced number of frequency. Like you may be bleeding like 4 times a year. That's quite low. You have mood changes because of the hormonal imbalances. Your mood may be irritable. You may feel depressed. You may feel like overtly anxious. You can have all the mood changes that are possible. Another thing people particularly notice is the development of hair, like where men grow hair. Like you can have a mustache or you can have little bit hair on your chin. And that might become worrisome because like if you go untreated, those hair distribution will get thicker and more number of hairs will keep appearing. Darkening of the skin, especially in the neck area, like there is a fold to the neck where the neck meets the shoulder, and also in the axilla. You can have darkening of the skin, but people predominantly think that is a skin condition and might go to a dermatologist. But that is because that condition is called acanthosis, meaning there is a black, velvety, thick patch of skin, which is due to insulin resistance, meaning like when your weight goes higher and higher, the insulin is a hormone which balances the nutrients inside the body. The insulin finds it difficult to deal with this condition, and it feels it gets a resistance from the body itself. So abnormal substances start accumulating in these flexural part, and that causes a kind of a dark velvety skin. Thinning of hair, and even you can have hair fall from the scalp, and you can get male pattern baldness. Like you might see men without hair on their vertex. So you may have, it can be patchy areas or it can be a general mild to moderate hair loss. Weight gain, people who otherwise eat normally, they are not binge eaters, or they don't binge on junk food, but somehow they start to feel that, okay, my weight is going high. I don't know why. So that can be one reason. There are other reasons, like hypothyroidism can be one reason, or other causes of secondary obesity, but still this is one common condition that needs to be kept in mind. Acne, the pimples. So that can also, the number and the intensity can be worse in women who suffer from PCOS. And skin tags, you may have seen, like especially even in obese people, you may have very small fine tags to larger skin tags that can accompany PCOS. So these are the conditions that you have to keep in mind. But if you only have pimples and no other symptoms, don't worry about PCOS. That is the thing about a syndrome. Syndrome meaning you have to have multiple symptoms that points to a single condition. So we have a criteria that if you meet that checkbox, then we say, okay, you have PCOS. So if you have only one, I have mood changes today, or do I have PCOS? No, you don't have PCOS. Like you have to fit that particular checklist. Okay, these 3 are there. So you have a possibility that you may suffer from PCOS and you may need to be evaluated. So what do we do, or what do I do if I see multiple symptoms that fits with these conditions. So where should I go? Which doctor should I seek? OBGYN stand for obstetrics and gynecology. So that is the specialty that you should go to, because that is the specialty that deals with this condition the most often. Then you can see medical endocrinologist, family practice. See, virtually those people who deal with endocrinology medicine, which I am a part of internal medicine, pediatrics and adolescent health, they used to get people who suffer from these conditions. And OBGYN perhaps will be the best specialty, because they'll be able to do most of the management in collaboration with medicine as well as endocrinology, where they need opinion in management or evaluation. So if you have these symptoms, my first opinion will be seek a first opinion from your gynecologist, whoever it is, and they'll evaluate you very well and they'll guide you what to do next. So this is important. When you go to the doctor, what you should expect, like what will happen to you. When you are, if I see a person who suffer from, or who is supposed to suffer from PCOS, or who has the symptoms of PCOS, the approach will be, we'll be taking a family history to know that whether any of your female members, like it can be your sibling or it can be your mother, who had these symptoms or not. Because if they had, then you have a fairly high chance of having PCOS, because it can run sometimes in families. So once that data is collected, I'll check your weight, height, body mass index. Then I look for that dark skin, hair distribution, pimples, your blood pressure and blood sugar, and record these things. Then I'll ask about your menstrual history, like how frequently do you get your cycles? Is it regular? And if you have your cycles, do you bleed normally, or the number of days previously, say it is 4, has it reduced to 1 or 2, and the amount of bleeding that was previously there is reduced? So these things will be recorded. Then, because it is polycystic, I will not be able to do an abdominal palpation. Like I'll touch your tummy, and to know whether your ovaries has got those bubbles, it is impossible for me to know, because they are so small. So we need to do an ultrasound. So you will be sent for an ultrasound, and ultrasound is the best to determine follicles in the ovary. So they'll find it out, and they'll see the number of bubbles you have, and the volume, like how large is your ovary. That will also be found out during ultrasound. And is there any other problems in your pelvis or in the uterus or in the tube, that will be reported. So that will be sent back to us. So if ultrasound shows those bubble, you have these symptoms, reduced number of cycles, then we can confidently make a diagnosis of polycystic ovarian syndrome. Because why this is important is, once we have to know for sure that what you are suffering from, is it just polycystic disease, like ultrasound shows those bubble, but you have no symptoms, absolutely no symptoms. So then we just keep you on follow-up, like we'll see whether you develop any of these things. If not, well and good, keep going, no problem. If you have any of those, then we make a sure shot diagnosis of polycystic ovarian syndrome. So this is the timeline. So suppose I have PCOS today and I am okay with it. I'm not going to treat anything. So this disease has got two aspects. Above that line, the gray zone is the ovarian part, like something which is restricted to your gynecological conditions. Like you may have reduced number of bleedings, you may have lesser amount of bleeding, lesser duration of bleeding, and that fertility issue. You may find it difficult to conceive a baby after your marriage. And even if you conceive, there can be complications with the pregnancy, early pregnancy loss, or may not be like sticking to the uterine lining very well and growing. Suppose you are a female who got the disease at the age of 20 years, not treated. You kept on going that way. Then after, like say for 40 years, you have problems due to that weight gain, which can be diabetes, which can be hypertension. And also there is a significant risk for uterine cancer. So these things can happen to you if you don't treat. But if you make an early diagnosis, you seek help from a doctor, they assess, they treat you, then all these complications can be avoided. So that is why this condition is so common. It affects one in 10 females, up to 1 in 10 females. It is very common. People hardly go for treatment. So this needs to be treated because this is a treatable condition. We'll come to the treatment of this condition, which is common for obesity as well. Verity, like there is a link given in the presentation. If you need, you will get this presentation also. Otherwise, just remember, this is a community that is based in UK. It's kind of a blog where they describe their experience with the disease, their symptoms, their disease. You can have interactions with them. So you will be able to have a community who has this disease and how they tackled it. And that can be quite supportive, especially like when you have limitations in discussing with your within or just outside your community. People may not be very happy to discuss these things, but if you need to discuss these things with somebody who has battled this condition, then you can join this community where you will get updated evidence-based information that will not mislead you, that will lead to a successful treatment of this condition. Next slide. So we come to the second part of the discussion. I did not touch treatment of PCOS, which we will do together along with the management of obesity at the end of the presentation. So I don't know, like everybody must have seen somebody who is overweight or obese. So it is not a condition that is new, or it is not a condition that is unknown to anyone. Like everybody knows this. But do we do something about it? If we see, or if I suffer from overweight, do we really do something about it? I don't know. It's a complex thing because obesity by definition, it is a large amount of fat or excess fat than what is needed for you. Don't be under the impression that like we don't need fat at all. Like I'll remain skinny and muscular. No, you need some amount of fat. For men, maybe like 20% of body weight has to be fat. For women, maybe 30%. So that much amount of fat has to be there. But if it goes over and beyond that, then that may not be the best idea to have. But there is also one more thing. From a medical point of view, if somebody walks into my clinic, say he or she is obese, and I tell them, oh, you are obese, then that will not be considered as a good gesture from a doctor, because I cannot presume that obesity is bad. No, I had one patient like who said like, yes, I know I am obese, but it took me so many years to get obese. Like this is the body I like. Like how can you think that this is bad? Like I was so surprised. Like, so you have to think that the normality that we keep, you have to remain normal. The waist size has to be 32. Who said that? It is my body, my life. I stay at waist size of 40. I like XXXL size, and I am happy walking in the society being obese. So that is the soft spot which you have to deal very, very cautiously. Like don't jump into the conclusion that you are obese and you are bad. No, they may like it, so it is their choice. So appreciate and approve others' choices. So if somebody come to me saying that I recently have got excess weight and I'm not very happy about it, okay, perfect. Now we are on the same page. So now I can say, okay, this is the condition of excess fat, which is called obesity. We can categorize this into like moderate, mild, moderate, and severe obesity, and we have different approaches to treat these things. Remember, obesity is one condition that starts from the very preschool age till the very end of your life. Anyone can be obese. At the same time, anyone can lose that excess amount of fat. So many of you, I don't know how many of you are parents. If you are a parent, please, this is a sincere request. Do not let your child be obese, because they don't know. They are not in that age group where they understand the implications of overweight or obesity. Do not listen to what others say. I'm not saying I'm the perfect person you should listen to, but if that is evidence-based and it is scientific, of course you should listen to. What the damage we do to our children is, we provide plenty of food. Maybe I grow up from a poor background, or if I grow up from a poor background and now I have everything around me. I have McDonald's, I have KFC, I have Domino's, everything. And I have online delivery system, they'll deliver to your doorstep. I don't have to go out. Plenty of time we spend with TV, games, everything. So I feed my children, like, eat whatever you want, I can afford. Keep eating. So you are a child, you can eat. Of course they can eat, but within the limit. If the point I'm trying to make is, if you make your kid obese, then that weight gain, that excess weight gain is going to go in that way only till he becomes adult. By that time, he has a huge amount of weight to lose, which is very, very difficult. Especially when it comes to female children, the excess weight gain can have implications on their menstrual cycle. They may get early beginning of their cycles. They may have horrible mood swings during their adolescence. They may find it very difficult to regularize their cycles. That extends to their marital life. They may have reduced amount of fertility, marital complications, marital conflicts, everything. Where does it start? It starts in the childhood. So preschool age, we are the responsible people because we need to take care of our kids, take care of that part. When it goes to childhood and adolescence, we might choose what do we eat. So all these things, preschool age, childhood, adulthood, old age, everybody can enter into a state of health which they can modify. It is their decision. If they want to be fat, they can be fat. If they want to be fit, they can be. They can stay fit, or we can help to become fitter. So we classify body mass index. The body mass index is, you measure your weight and you divide that weight by your height, which is in meter, and it needs to be squared. So meaning, if I am 65 kg, 65 divided by, I am say 170 centimeter, it is 1.7 meter, 1.7 into 1.7. 65 divided by 1.7 to 1.7, that will give you your body mass index. Problem with body mass index is, it do not separate your muscle and your fat. So we don't separately weigh my fat, how much is my fat and how much is my muscle. I just stand on the weighing machine and I see my weight. So it is a combined weight. I have some amount of muscle and I have plenty of fat. So it will not see a difference. Say, like I assume you may have seen wrestling or bodybuilders. Their weight will be massive. They may be 90 kg. So their BMI, as per BMI, they'll be obese. But are they? No. It is their muscle mass. So that is one problem which you need to know about BMI. It do not separately calculate fat and muscle. It is a total weight that we get. So if you classify according to that, you need to be keeping this information in my mind. You have to interpret according to the person's physique. So look at them, then you interpret that BMI. So this problem can be solved by calculating fat percentage. We have calculators available, so which gives you directly fat percent, how much fat do you have. Next slide. Yeah, these are body fat percentage calculators which are available online. You can calculate. And as per that, if you are a female and you have more than 33% of fat, then you will be classified as obese. If I'm a man and if I have more than 25% of fat, then I'll be classified as obese. So this will give you a much better clarity about the amount of fat that you have, because we need to lose fat, not the weight as such. So what causes obesity? We blame the eating habit of people, like you eat a lot and that is the reason why you are obese. That, although that may be the case in majority of situations, but you have to keep in mind, they may suffer from a medical condition. Say hypothyroidism can cause some amount of weight gain. PCOD or PCOS can cause some amount of weight gain. So we can't presume like, oh, you eat a lot, that's why you are obese or you are overweight. Think about these conditions in the back of your mind before jumping onto the conclusion that you are overeating. Because why this is important is, unless you treat that particular condition, she or he may not be able to lose amount of like her excess amount of weight, and we blame them. So we overlook the condition that is causing the weight gain, and we blame the person for not losing the weight. That is not a very good approach. So causes of obesity, it can be stress, reduced sleep, overeating, other medical conditions. Complications are many, majority of which we already know. You can have heart attack, you can have stroke, you can have cancer, fatty liver, kidney problems, everything. Every system will be affected. That is why we press so much on controlling your weight and staying fit. So this is something you have to know. You have to think about losing fat, not exactly losing weight. Why this is important is, suppose if you stop eating, I'm not eating anything from tomorrow. Of course, you will lose weight. The weight that will be lost will be your muscle, because your muscle will be utilized for survival of the body. There is an interesting thing, like, is the body so dumb? Like, if I overeat, then why can't the body metabolize it and stay fit? The body knows, like, I should look good, I should look handsome, I should look beautiful. Then why can't the body metabolize these things and dump these excess weight? For the body, the weight means survival. Like, if I go to a desert, if I get stuck somewhere, I need to survive. So you need the fuel. The fat is the fuel, or fat is the store. Like, if we are, like, during COVID times, we purchased like everything, and we kept in, like, we like replenished our stock like anything, just because we don't know when is the shop going to open next time. So until that time, I should be happy with my stocks. Body does the same thing. It keeps the energy in reserve, so that if your food gets deprived, okay, you can survive for some time. But if there are no such conditions, and if you want to lose your excess fat, you should lose fat only, not your muscle, just to lose your weight. So that is the slide that shows both of them are of the same weight. Both of them have 60 kgs. First person has got 20% body fat. The other person has got 35% of body fat. That excess 15%, that is what we want to lose, not the weight or the muscle which is already. So this is for exercise. Based on exercise, we categorize as like somebody who is an athlete, somebody who is concentrating on physical exercise, somebody who is concentrating on physical activity, because all these three are different. Physical activity, if I take a walk, that is physically active. Physical exercise is a repeated and designed set of movements that will make you physically fitter, or that will increase your physical fitness. Sport is an athlete. Let's say for Virat Kohli, he is fit, and he's from a sport, and he's an athlete, and he maintains that way. We don't spend much of our time on this slide. We move to, so here we are. We are the team that represent curiosity, and we are really, really curious about the well-being of our people, or the humans. We concentrate particularly on lifestyle diseases, and we are growing in such a way that we'll be able to provide everything that you need to stay healthy. So we go by this vision. We make healthy choices the easy choice. So if you make the choice to stay healthy, we'll make it so easier so that you can achieve your goal as quickly as possible in the best possible way. Now we come to the treatment part of both of the conditions. Most of them are similar, except maybe for medication. So I'll talk about PCOS first. We need all three. The prime target has to be losing fat, and along with that, you might lose some weight. That is to improve your insulin activity, so that your fat distribution and your hormonal imbalance will be diminished, and you will have reversal of your symptom. You will lose weight, your physique gets better, your fertility gets better, your risk of diabetes gets smaller and smaller and negligible, and you will avoid complications of PCOS. The drug part, sometimes the gynecologist might give you medications to regularize your menstrual cycle so that your periods get better and better. There may be treatment to improve your fertility if you need to, if you have difficulty in conceiving a baby, they might help you with the drugs. Other than that, it is all about diet and physical activity, which we will be able to provide in the best possible way. There is an aspect about both PCOS as well as obesity that it affects our mood. It might cause a depressed feeling, because if I'm not happy with my body, my overall confidence may be lower. My social life may not be that good. So that will affect your entire mental well-being. But we have a lot of trouble conveying this to even to my partner. So they presume that mental health is a part of everyone. It is their own business. I don't have to intervene. They'll take care of it. It's okay. It is okay to be mentally disturbed. No, it is not okay for me to be, or anyone to be mentally disturbed. I need help. So that part needs to be taken care of. So say, for example, somebody who is already in a low mood because of their body physique or low confidence, and we ask them to do exercise. It's simple. Do exercise and have a healthy diet. But I can't do it. That is the problem. So they may need to be motivated. We may need to support them. We may need to provide for them so that they'll achieve their goal and their overall health gets improved.